Hello and welcome to Healthy Kingston. This is our second year and we are all that much more excited about the programming for the next few months, and again have many interesting speakers planned to help address some of the health issues, preventative, wellness, and disease issues that we have in the town of Kingston. So with that said, I'd like to introduce again our health agent, Arthur Boyle, to give us an update.
Well, where do we begin with Tripoli or West Nile virus? We've had vaping has come along and taken Tripoli off the front page of the newspaper, but it's still a danger out there, and it's a very grave and serious problem, because you just don't know whether, Kingston, which has been at the moderate level for some time now, is right next to communities that are high risk. So you've really got to be careful and use precautions, and wear long sleeves after dusk, and wear plenty of mosquito repellent with DEET, and there's no reason to have an infant at a football game at 6 o'clock at night. You don't like to lecture the parents, but the truth of the matter is you got to use good sense, and good sense says don't put somebody in an area of danger, and this is a very dangerous time of the year.
Exactly. And as you know, we want to share with you, we do have a Tripoli expert coming to speak with us a little bit later in the show. His name is Daly. He's the community liaison for Plymouth County Mosquito Control, and he'll be getting into a little bit more depth about Tripoli and its potential impact on our community. And vaping.
Well, vaping is virtually everybody knows at this point. Governor Charlie Baker put a ban on vaping products and vaping in general, effective for 4 months down the road, which would put us towards the end of January before there's a decision made as to what's going to happen. But we, interestingly enough, had our first death in Massachusetts just 2 days ago with a woman from Hampshire County, and that was attributed to vaping. And there's still so little known about it in terms of the safety issues. The kids can tell you more about it than we can tell them, but right. The truth of the matter is that that's a great danger as well. You don't know what you're putting in your pipe and smoking.
Yeah, literally. So, right. Well, so more to come.
More to come is right.
In the future.
And we appreciate the fact that you've done this for the last year plus now, and you've done a great job of getting the word out to people about a healthy Kingston, but healthy habits in general. Thank
you, Arthur. And you the same. You've certainly been a big help in that regard. You've done a tremendous job for the town thus far.
Well, it's a lot of fun.
Okay. I would now like to talk to our Tripoli expert, Daly. He's the community liaison for Plymouth County Mosquito Control. And I know there are a lot of questions out there, even though there's been a lot of information disseminated by the press. So we thought that this would be very timely to get someone of his expertise in here. So thank you so much for being here. We appreciate it very much. So what exactly is Tripoli and how is it transmitted?
Well, we know Tripoli, in its roots, the Eastern equine encephalitis. For a long time, they thought it was just something that impacted horses. As far back as 1831, I saw a record of 75 horses dying that summer from Tripoli. And it wasn't until 1938 that we discovered Tripoli also jumped to the human population. And that summer, 100 people in Massachusetts died from it. And it's a disease spread by mosquitoes, as we all know. And a lot of people say, well, do all mosquitoes have that Tripoli, and then how do they get it? And it's estimated that in a real bad season, not even 1 in 100 mosquitoes have it. But the way they get it, and it's the female mosquito that is the one that's spreading it. The female mosquito needs a blood meal so its eggs can survive. And so that mosquito has to bite an infected bird. So it's the bird population that sort of runs that show.
Huh.
So if you have birds with the disease, well, in Kingston, I know you've had this year, you've had a number of Tripoli and a couple of West Nile virus findings in the mosquito population. And for West Nile, it's the same thing. a bird has to have that virus. So when a mosquito comes and takes the blood meal, that's how that mosquito gets infected.
No specific bird.
Well, the ones that generally we look at for Tripoli, the cedar swamps, the red maple swamps, the mosquitoes in there, the Culiceta melanora mosquito is one that we use to know what, how bad the things are going to be. But that's a swamp kind of thing. For the for West Nile virus, to just jump a little bit, that's the mosquito that's in your yard. That's the Culex pipiens mosquito. And that's the one specifically that Department of Public Health targets when they tell people, empty your standing water on your property.
Okay.
Because that mosquito on your property probably hatched out on your property somewhere. And so I would just mention this real quickly, that we have a service at Plymouth County Mosquito Control. Now that the spray season is over, anyone who has tires in their yard that they like to get rid of, you can call us.
Really?
And we will take it away free of charge, because those tires are a great breeding site for that kind of a mosquito.
Okay, and we'll make sure that you receive the telephone number to call to do that. That's great.
Yeah, it is.
Huh. So we all think about the evening. When is exposure most likely?
Well, we know that most people probably aren't up running around at dawn. Most people.
Right.
I know I'm not, but they say dawn and dusk. But we now also have a lot of mosquitoes, excuse me, that are 24/7 biters. There are a lot of day biters out there as well. It's just I think that the level of risk increases as we get towards the end of the day, and even in the middle of the day. I'd like to think it was going to be warm again for a while. I have my doubts right now, as if you're working in the yard, you're going into shade. That works about the same way. Yeah. And we did talk, I heard you talking about using repellent, something very, very important. We know these mosquitoes are going to be here until the first hard frost. Now, a lot of people say that, but very few people bother to define it for people. What is that first hard frost?
Right.
And we know it's the temperature has to be at 28 degrees for 3 to 4 hours. And that's the frost that's truly the killing frost and ends the threat with the mosquitoes.
Okay.
And until that happens, people really ought to be using repellent. And I heard your health agent talk about DEET, which is absolutely wonderful, but there are a lot of people that won't use it for one reason or another. But
I think they're afraid of it.
Yeah, well they're afraid of over-application and that kind of thing, but there are others out there. And the key is always when you buy that can or that spray can or whatever you're going to use, look on the bottom back in real small letters and numbers for the EPA registration number. Because if it's registered with the Environmental Protection Agency, you know two things. It works, it does what it says, and if you use it following directions, it's safe for human use. So there are others out there like picaridin, which is probably the #1 product used in Europe. Oil of lemon eucalyptus, PMD, which is the synthetic version of oil of lemon eucalyptus. They all have that EPA registration number.
Okay.
And another one called IR 3535 that you don't see so much around here, although Avon sells it, and in their Skin So Soft, they have a couple of repellents, one picaridin and one IR 3535. I'm just saying, I'm not recommending one product over another.
Right.
My recommendation is very simply make sure it has the EPA registration number on it, and that's your best bet, especially with such a devastating virus around with Tripoli. You don't want to take any chances.
That's an excellent point. So why is Tripoli harmful? And what are the symptoms of Tripoli?
Well, Tripoli is very dangerous, and I'll start with that, where better than 1/3 of the people get it die. And many of the survivors have neurological issues the rest of their lives. The swelling of the brain, so it's very dangerous, obviously. Symptoms, headache, stiff neck, fever, nausea, vomiting. If you have those things going on, you should get to a doctor.
Yeah. And it's tough because they're fairly standard symptoms.
They are.
Could be indicative of a number of different illnesses.
Even West Nile virus has, the only difference I saw looking at it is that West Nile virus, you have to have a rash as well. That might be something very distinctive. And yeah, so with the West Nile virus, though, the upside is about 80% of the people who get it don't know they've ever had it. It doesn't come up with any symptoms at all. It's a very, very small number that shows symptoms, and the vast majority of those people recover after a few weeks.
Now, Tripoli, there's a time, there's like a latency time between when you're exposed and when you actually come down with the symptoms.
Yeah, it could happen 4 to 10 days.
Okay.
That seems to be that, and then going back to the West Nile virus, that could happen quicker. That could be 2 to 14 days. So it's quite a gap in there. Go ahead.
What do you think you do? What should you do if you think you've been exposed to Tripoli?
Well, that's kind of a broad question, isn't it?
Yeah.
People that get a mosquito bite should not assume that they have Tripoli.
Right. Oh, I know, and I know you probably do too.
Yeah,
Everyone I know who gets a mosquito bite is just freaking out these days.
I know. One of my daughters has a 5-year-old son, and she's very much in fear of any mosquito coming near him, as she should be. She's taking precautions, but just because you have a bite doesn't mean you should be rushing off to the doctor.
Right.
There's no specific treatment for it, but once you start showing those symptoms, like I said, you probably should be visiting a doctor anyways.
Okay, so they treat the symptoms, basically.
Well, there's no treatment for it,
right?
But there's care they can give you while you're in the hospital trying to recover, but there's no specific remedy for it.
Okay. So even though most people know some of this information, you certainly gave us some new information. So I would say the important takeaways would be?
Certainly use repellent.
Okay.
And it's, and another piece of this I think is important is these periods with Tripoli seem to go in cycles. And we had one that was 2006 to 2008, 2010 to 2012. And 2012 was a big year. They found 262 samples of mosquitoes with Tripoli. This year there's over 460 samples, so this is even bigger than that.
Bigger than that,
This is the first, so I would be anticipating, no one knows, but I would be anticipating whatever lessons we'll learn this summer, carry them over.
Carry them over.
To next year.
Right.
And incidentally, the state has a wonderful website for people to go to, which I'm sure you've been on. If they just put in their search engine, mosquitoresults.com, it takes you to the DPH's website where they list every mosquito found, the species of mosquito, where they were found, what date they were found. And just looking at Kingston today, I noticed all the ones in Kingston happened from July 22nd through August 15th. That was
interesting.
Doesn't mean they're not here now.
Right.
But that was when we found them with our traps.
Okay, and we'll display that site as well.
Yeah, it's a great site.
And so we all start praying for frost and
yeah, I guess.
28-degree weather.
Just then have a comeback right after that, back to about 65.
Exactly. Thank you so much.
Well, thank you for having me.
Dan, appreciate you being here. Excellent information.
Thank you.
I'm now very pleased to have the opportunity to introduce you all to Jennie Babcock, who is the chair of Plymouth County Suicide Prevention Coalition. And she has a wealth of information to share with us. I imagine, unfortunately, most of our lives have been touched by suicide, either a family member, a friend, community member, a neighbor. So being that it's such a serious issue here in the United States and really in epidemic proportions, I felt it would be important that we speak with Jennie to find out a little bit more about it, maybe what's causing it, symptoms to look for, resources. So with that said, Jennie, thank you so much for being here.
Thanks for having me.
We
Thanks
really
for inviting
appreciate
me.
it. Absolutely. So could you tell us what is the extent of suicide in the country and statewide, possibly even locally?
So I'll start with the country. In the United States in 2017, there were over 47,000 deaths by suicide. Wow. And whenever I'm teaching a class, I ask people to think of Fenway Park. And Fenway Park only holds about 39,000. So
yeah.
You can picture that, you can image that. So it is high, it's very high, and it's been increasing every year. In Massachusetts, though, we rank number 48 out of all the states, and 48 is on the high side, meaning it's number 48, but it's low in suicides. In Massachusetts last year, we had 642 suicides. Just drew a blank,
Well,
sorry.
locally, do you have any indication?
I do. So I just started getting current data from the DA. And I don't ask, it's no personal information. We just want to know what town, what age, sex, and then the means, basically, so we can try and look at, is one town suffering more than the other? Is another reason? Is there a method that people are using, almost copycatting? So last year, 2018, there were 52 deaths by suicide, just in Plymouth County. Already this year, there's 48.
Really? Numbers are
To
going
me,
up.
that's alarming.
Yeah.
You know, we're focusing, because we only have last year's data and so far for this year, we don't really have anything to go on, but we know where we have to focus some of the work that we're doing. Women attempt more often than men, but and
more
we hate to use
successful.
the word successful,
Yeah.
because there's nothing successful about suicide.
Right.
It's usually a 3-to-1 ratio. And when I broke down the numbers from 52, it ended up being 41 males
Really?
and 11 females. So it proved it to me right there, even
Right.
in our own community.
Yeah.
The age groups, youth, or what we call youth, which is ages 15, and it actually now goes to 24, and some people extend it to 34, is the second leading cause of death in the United States.
Right. That's a
Suicide
major
is.
statement.
And
Wow.
that's huge.
Yeah.
One other thing, suicide itself in the United States ranks the number 10 cause of death. And I always say, in my classes, you see on the news every night homicides. You hear about it. It's in the paper all the time. Homicide ranks number 16. Suicide ranks number 10.
Interesting
And
Yeah.
nothing's said about it,
about it. Yeah.
unless it's a celebrity.
Yeah.
Usually that's when you hear it, and you see it on the forefront when it's a celebrity.
Well, I would imagine, too, there's a tendency for families to kind of want to keep it quiet. That might be part of that, too. Are these numbers fairly representative of what's truly going on?
Absolutely. And I agree with you. Families sometimes still are ashamed, are afraid, and that's the part of the stigma that we're trying to get rid of.
Right, and deal with.
You know, every time I go to different places and I start talking to people and they'll ask me what I do for work, and I tell them, I usually hear, I know someone who died by suicide, or this happened. So we get into talking. It's
What do they find, or what do you find usually precipitates it? What causes it?
It really depends upon the age in what we're looking at. With youth, I'd have to say it's definitely peer pressure. Social media plays a huge part. Think back when we were younger, we didn't have telephones that have that instant message going out, or Facebook that has that. I truly believe that is a huge part of it, because you see posts all the time about something, and then you hear, oh, well, they posted a bad picture of me, or of that person.
So bullying.
So bullying is part of it. We actually lose 20 veterans a day to suicide as well. It was at 22, but the VA did release a study recently saying that it's down to 20. There is an organization out there called 22 Kill, and it stands for the 22 veterans that we lose a day to suicide. That's actually what this ring represents, because I support it. We do the work for that. We do the training for them. So veterans have a very high rate.
Is that here? Where is that, the 20?
That's in the United States.
It's in the United States.
Yep, that's
Okay.
not just Massachusetts. That's across the United States.
Okay, and obviously PTSD is an issue with them.
PTSD plays a part of it, but a lot of times, even with middle-aged men, which is a very high risk factor too, it's maybe a divorce situation, or maybe they lost their job and now finances come into play, that they feel that they can't support their families. It's the same thing with the military. You know, they come back from being in combat, they don't have people to talk to that can relate to what they're going through.
Right.
So part of that 22 Kill organization is they match people up that have also been in combat, that are trained, and they'll stay with a person. If a person is truly suffering and in crisis, they will stay with them until they're okay and
What
safe.
about seniors?
Seniors is the other one. Seniors have, as far as percentage, I don't know that figure, and I don't want to say something wrong. Seniors have a very high rate, and a lot of that attributes to, you know, someone losing their spouse after many, many years, being the last one left in a family. All their friends are gone. They don't have anyone to turn to. They feel like they're a burden. Sometimes, you know, elderly, they lose their house and then they have to go into housing. And it's depressing to them. It's very,
Sure.
you know, depression is one of the main reasons, but usually it's depression along with something else. So we always say there's something co-occurring.
Right. So obviously, this is a very serious problem, and
Yeah.
it's impacting our entire population,
Yeah.
nationally and locally. What are some signs we need to look for?
As I stated, depression is one of the biggest reasons. So, you know, if you notice that somebody is feeling depressed or acting depressed, and signs of that is just withdrawing from family, withdrawing from their friends, maybe school activities, dropping out of teams, and not picking up another team that they may have been on. You know, personal hygiene could be an issue. With elderly, we look at that. Just being disheveled and unkept. Drinking. Maybe they never drank before and now they're drinking, or they quit drinking and then they go back to drinking. You know, there's all different signs. There's a couple classes that we actually teach that will go through the signs and symptoms of somebody who might be in what we say in crisis or in danger. And if you're worried about them, we need to teach people those signs. So my biggest thing is to say people need to get educated.
Well, we'll make sure to get, what are the names of these programs, and we'll make sure that they're on the screen so people will have access to them.
One of the programs that we do, we call it Suicide 101. It's very similar to CPR. It's called QPR, and it's Question, Persuade, Refer. And the class is about an hour and a half, and we teach you the signs and signals of somebody who might be in crisis, but also how to ask them if they're thinking of suicide.
Okay.
That's a word people don't want to say.
Right.
But then we also show them how to refer that person to the next person, whether if it's the emergency room or, say, a psychologist or psychiatrist. We say it's very similar to QPR. With CPR, you're helping somebody until that, you know, doctor can get there or the ambulance.
Right.
QPR is the same way. You're going to stay with that person and talk to them and coach them and get them to where they have to go to be safe.
Right.
So that's one class. We do another one called Mental Health First Aid, which is an 8-hour course. We have a youth version, there's an adult version, there's an elderly, there's all different modules. One that we're focusing on right now is public safety. We've trained a lot of the officers, police departments in Plymouth County in, you know, mental health first aid, and that goes through the signs and symptoms of somebody having a mental health crisis or an issue, might have a diagnosis, and when they're having a crisis, sometimes if the police get on the scene, they don't know if that person's on drugs,
Right.
Have they been drinking, or is this just a mental disorder that they may have?
But anyone in the
Anyone
community
can take
this
courses.
course. So
Yeah.
if you're thinking your child, a family member might be having a problem, it sounds like an excellent class to go to get a better idea as to what you're dealing with.
Yep. And they're all free.
Oh, they are.
They're all free.
Yeah.
Our funding, so Plymouth County Suicide Prevention Coalition is one of 10 across the state. So our funding actually comes from the Department of Public Health. So the funding that we get each year covers all the trainings.
Okay, and we'll, again, not only with the names of the courses, but we'll put down the website and how you can actually go to register for these classes.
Yep.
If you have
Excellent.
any questions. Resources. I know people are always looking for resources. Other than, you know, becoming educated.
In all my classes, I do have a resource sheet that I give out that has the 1-800 number on it for National Suicide Prevention.
What is that?
1-800-273-8255. You can also text 741-741. United Way does have a 3-digit number, 211, and across the nation, very shortly, they will release a 3-digit code. We haven't got the final numbers yet, so I can't say what it is, but instead of calling the 1-800-273-8255, it's going to be a 3-digit number, which is simple.
And this is if you're feeling suicidal, you have a family member you think is suicidal, so it's for all.
For everybody, you can call.
Every type of question related to suicide.
It doesn't mean you don't have to call just because you're in crisis. If you have a question or you're worried about somebody, call the number.
Okay.
Because somebody will be on the other end.
Okay. All right. This has been tremendously beneficial. Thank you so much, Jenny. Really appreciate
Thank
it.
you.